I'm open to the idea that because we've become more tolerant, there are more people volunteering to have their sex changed as a kid or as a teenager. But I could not understand why the rate of teenage girls doing it was something like 5 times the rate of teenage boys. That struck me as ding, 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 ding.
Right.
There is something else going on here. And yet immediately we were told, we're told rather improbably that there are never any mistakes, just as there are never any, no child is ever wrong, no teenager is ever wrong. And yet we definitely have cases of it going wrong for teenagers. But let's talk about this phenomenon that is not actually accepted in the scientific literature, the rapid onset gender dysphoria, which happens in early teen years for girls entirely.
Well, let's leave the scientific literature issue to the side, because there's a lively debate ongoing about ROGD, whether it's real, what the evidence is for and against. We can get to that if you want, but let's leave that to the side for the moment. So beginning in the late 2000s, gender clinics in a number of countries started to report a change in the type of patient they were seeing. I should say pediatric gender clinics. And, there was only one. The first pediatric gender clinic in the United States was founded in Boston in 2007. There are now more than 100 of them. And until then, there was one in Toronto, there was one in Amsterdam. And these clinics started to see, especially as the 2010s kicked in, they started to see a fundamental shift in the demographics of their patient cohorts. And whereas previously most of the patients were boys whose gender issues started very early in childhood, now most of the patients were girls. Most of the referrals, I should say, were girls, adolescent girls with no prepubertal history of gender dysphoria or even significant gender-related distress. Many of them were not even that gender non-conforming in childhood. So that's number one. Number two, the number of these girls was astronomically higher than the number of the boys who had been historically referred. So just to give you a sense, in the UK between 2009 and 2018, referrals to the Gender Identity Development Service went up by 33-fold. In the United States, we don't have very good data, but some preliminary reportings and an investigative piece by Reuters last year and data reported by some of the major gender clinics, including in Portland, Oregon, show very similar trends. In Portland, Oregon, for example, they saw an increase of 4,500% between 2013 and 2021. So
these and the majority of these are girls?
Correct. So 2/3 to 3/4 of these referrals are adolescent females with no prior history of gender issues. So that's the second important part. So the first key fact is more girls than boys. The second is skyrocketing rates of referrals in a very short period of time. And the third is very high levels of psychiatric comorbid conditions. Anxiety, depression, eating disorders, autism is extremely common, ADHD, OCD, history of trauma and abuse, you name it. So these are very troubled teenagers. And that raises, of course, the question, how to understand the relationship between all of these mental health problems on the one hand, and the fact that they reject their sex, reject their bodies on the other, and want to transition on the other. So this was the big demographic change, the change in clinical presentation and the very rapid increase in the caseload that gender clinics across the West were recording. And the question, of course, is what's driving this? And so you have two competing theories. One theory is that it's just an organic development, that these kids always existed, that they're just coming out of the closet now because society has become more accepting and more tolerant. I think there's a number of problems with that theory. The first is, activists on the other side like to give the example of left-handedness, right? They say something like, if you look at the graph of left-handedness in the United States, you see that it increased between 1900 and 1960 by 300%, from 4 to 12% of the population I think among school children, were left-handed. And that this is not a social contagion of left-handedness. This is just because schools became less, insistent that students learn to write and only with their right hand. By contrast, in the case of gender dysphoria, the rise was thousands of percent within 1 decade. So just on that score alone, I think the analogy to left-handedness is very questionable. But the other thing is, if this was really a matter of warming social attitudes, of society becoming more accepting and more tolerant, first of all, why are we seeing, as you put it earlier, Andrew, why are we seeing so many more girls than boys do this? Especially because historically there have been so many more boys than girls. You would expect to see something approaching parity, maybe not exactly 50-50, but you would expect to see more or less even distribution of boys and girls, of adolescent males and females, and that's not at all the case. And more than that, why are we seeing this almost exclusively among young people? If society is becoming more tolerant, wouldn't you expect to see adults come out of the closet at higher rates?